everybody. This is Grace with Intero Real Estate. Thank you so much for joining me on this call today. I have a very special guest, my friend, Dr. Joe Jabre, with me. And as you know, I'm doing these videos in May because May is the National Stroke Awareness Month. And Joe, Dr. Jabre here, is a neurologist friend of mine, and he has helped me a lot when I was going through my stroke and during the recovery. So he is very sweet to be on the call today and talk to us about strokes. How are you, Joe?
Hi, Grace. Good to see you again.
Yeah, thank you so much for your time and being here on the call today.
Absolutely. I'm happy to do it.
Okay, so I want to do an introduction of Dr. Jabre here. Dr. Jabre. So Dr. Joe Jabre is a highly accomplished neurologist with 30 plus years of experience. And he was a clinical professor of neurology at UCLA. And his research in this space includes being the chief of neurology services at Boston VA, which is a teaching hospital for Harvard Medical School and the Boston University. And since 2005, Dr. Jabre has been the CEO of TeleEMG, and it is a company that specializes in cloud TMS technology. And the cloud TMS technology it's actually a machine, and it's a computerized medical device that administers the outpatient treatment of EDD, or major depressive disorder, for adult patients and without medication. So this machine produces a non-invasive, repetitive pulse magnetic fields of sufficient magnitude to induce neural modulation in the prefrontal cortex. How did I do? Joe, did I get that right?
I'm impressed myself now.
Thank you. Thank you. Joe, like I said, when I was going through my stroke, you were there, walk me through it, and you were on my speed dial, and you taught me a lot about it and how to handle it. So I'm very grateful to have you as a friend and you being the expert in this field. So Joe, when you taught me a lot about stroke, and there are actually multiple different kinds of stroke, right? So what are the different kinds of stroke and what are the symptoms?
So first of all, thank you for having me. I appreciate that. And even more importantly, thank you for doing this in the Stroke Awareness Month, because, a lot of people get to these things not even expecting that it will happen, not even if they knew that it might happen, not expecting what the outcome is going to be. So thank you very much for doing this. I think you're doing a great service.
Yeah, thank you.
I just want to add a little bit to your introduction about you. Is that I met Grace probably a week or so for the first time before this happened to her. And we just happened to be visiting with a common friend, and we just chatted a little bit. Then she was in Southern California, then she went back home. And I think a few days later, I got a call that she had a stroke. And I'm saying, this woman is young to have a stroke. She looked healthy. She looked active and very accomplished. And so I was very, very surprised. And then she told me the whole story. And I know that you have already recorded this on YouTube, saying what happened to you and everything. So I think that was a very interesting coincidence that we met very shortly before then, and then we started talking about this right after that. So now the answer to your question, there's literally three types of events that we call a stroke. Mm-hmm. One of them is when a blood clot travels through the arteries that lead to the brain, mm-hmm. and obstructs the blood vessel that actually is sending blood and oxygen to the brain. And so there's a brain tissue damage, and it causes weakness on one side of the body, left or right. Mm-hmm. So that's one type of stroke. Another type of stroke is what we call a hemorrhagic stroke. The previous one I just described is called an embolic stroke, due to an embolus. And an embolus is literally a blood clot, mm-hmm. that flies through the blood and starts to clear the arteries. And at one point, the arteries become too narrow to be cleared. So the blood clot gets stuck there. There's damage to the tissue of the brain where that blood vessel was nourishing it. And so you have deficit, and that means causing a stroke. So the first kind is embolic stroke. The second kind is hemorrhagic stroke. The physical symptoms may be the same, but the actual symptoms that the patient feels are very different. So in an embolic stroke, in a blood clot stroke, you feel weakness and some dizziness, and sometimes you probably have some speech difficulty. But in a hemorrhagic stroke, actually a blood vessel inside the brain breaks and the blood starts leaking. And patients describe the feeling when they first get this as the worst headaches that they've ever experienced in their life. So you can't miss that if that's happening, and it could be very dangerous. Usually is caused by high blood pressure and some weakness of the blood vessel wall, so that the high blood pressure pressing on it, creates a rupture and the blood comes out. But hemorrhagic stroke are a bit more dangerous than embolic strokes, to be clear. Then there's a third category, which we call TIA, which stands for transient ischemic attacks. Same thing as the embolic stroke, but the difference is that at some point that blood clot that's trying to clear the blood vessel to continue its trajectory in the blood manages to go through that blood vessel. So what happens is it gets stuck for a short period of time, therefore causing the symptoms of a stroke. When you're having this, you don't know that you're not going to have a stroke. You think you're going to have a stroke. But then at one point, it manages to continue its trajectory and clear the blood vessel. So it opens up the blood supply to the brain again, and the symptoms disappear. By definition, so we call it transient ischemic attacks, or TIA. By definition, if anything lasts more than 24 hours, Grace, then we call it a stroke. If it clears before the end of the 24 hours, we call it a TIA.
I see. So it is interesting because what I had was the embolism. I had the blood clot.
That's right.
I experienced slurred speech and let's see what else, and droop, facial droop. So that's my symptoms. But the other kind, the hemorrhagic one, is actually a headache. Like you can't miss it. So that's what you describing. Right.
Severe headache, exactly.
Yeah. And so you brought up a very good point. So sometimes these symptoms, if someone is experiencing something but it went away, they could be experiencing TIA. So they shouldn't ignore the symptoms, because they should go to the hospital right away in that situation.
Absolutely, and I can tell you, you may have been having a TIA. Because and I'm not suggesting to wait, that's not the point at all, but what I'm saying, that blood clot could have cleared your blood vessel and went away on its own, but you should never wait to find out if you have a TIA. Yeah. As soon as you get symptoms, and you were lucky in that instance where you had some people with you that actually took you to the hospital, but as soon as you have any symptom of that nature, don't think twice, just head to the hospital.
Yeah, so that's a great piece of information. Don't think that, it went away, I'm okay. So not wait for another incident, then it might be more damaging in that case the next time. Exactly. So, I was talking to another group of colleagues and about stroke awareness. I think stroke is like earthquake, right? Like I'm here we're in California, so we know we have earthquake risk. We always have this risk, but stroke is like earthquake because there's no symptoms leading up to it, and it can happen anytime. It's just like an earthquake in California. And
no, that's exactly right, and that's a good point. You can't expect it. There's no symptoms leading up to it until you get it, essentially.
Yeah.
Occasionally, I should say that the TIA can last for a very short period of time. So by the time you become aware, like minutes or hours. So by the time you become aware of it, it clears itself and you don't think twice about it. But in that case, because it's already cleared, the TPA, which we'll talk about in a moment, that you receive, The TPA is no longer indicated, but at that moment, if it lasted short enough time so you didn't need to go to the hospital, they need to find out what caused this. And I want to immediately indicate that, you know, in a young age person, a cause of a stroke may be very different from an older individual. So in your case, you had one particular cause. If you were 65 or 70 years old, you may have another cause to cause the same symptom, but it will be different.
Yeah, so of course, the day when it happened, having a stroke was the last thing on my mind that day. Like you said, I was just going about my normal day. Like you said, I am in my 40s and I don't have high blood pressure, or I'm not overweight, or I don't have high cholesterol. And, you know, I work out. So it was the last thing on my mind, but it could still happen. It could happen. It could strike anytime. So that's.
Well, I have to tell you that when our common friend called me to let me know what happened, my first comment to our friend was, I don't think so. She's too young for that. Oh, no, she is having a stroke and she is on our way to the hospital. I'm telling you, this is happening. So my first reaction was, she's too young for this.
Oh, you know what? Not just you. When I get to the hospital, I was actually challenging. I remember myself challenging the doctor. I said, are you sure I'm having a stroke? And he said, yeah, we saw it on the scan and you're having a stroke. I said, oh, okay.
Oh, yeah, I would have been surprised too, yeah.
Yeah. So, Joe, so you brought up a good point. I had a blood clot to my right brain. That's why when I get to the hospital, I was paralyzed 100% on the left side. But I can
let me stop you for a moment here, because I'm sure most people know this, but one thing that I failed to articulate at the outset was the brain and the body are crossed. So if you have right side weakness on your right side, it's the left brain that has a problem. If you have a weakness on your left side, it's the right brain. So they're not on the same side. I just want to be clear about that.
Yeah, and the clot on the left and right side actually manifested, the symptoms could manifest differently as well. So I was telling you that the clients I was with told me that I had slurred speech, but at that time in my head, my speech was clear. I couldn't hear it myself. And then I did not feel any muscle weakness, or I did not fall or anything like that. But you said that is a common symptoms, right? If it is a clot on the right brain. Yeah?
Yes, thank you for bringing that up again. Exactly right. The symptoms of a left brain, right body versus a right brain, left body weakness are very different. In your case, you had it on the right side of your brain, which is the area that gives you consciousness of space and area where you are in. And a very interesting symptom of right brain strokes is that people don't really become aware either of their weakness on the left side, or of their speech difficulty, or any of these things. And that's a typical, we see that in stroke patients with left-sided weakness. And I have to be clear by saying here that instead of saying right side brain or left side brain, the dominant brain in the great majority of people is the left side. The non-dominant is the right side. So if you happen to be left-handed, this is completely the opposite. But in your case, you're not, you're right-handed. So a typical symptoms of right brain strokes is patients experience something we call neglect. They neglect to notice either their speech difficulty or their weakness. They feel dizzy. They don't have a headache. They feel dizzy and somewhat disoriented. They don't exactly know where they are or what's happening to them. But they completely neglect it. And I will add to this, then as a neurologist, when I approach a patient with a right brain stroke, I always approach them in the right side. I never approach them from the left side of their body where they're weak, because they may not pay attention to me or listen to me. So basically, we are very aware of that and try to remain conscious of the fact that if you approach the patient from the side where they are weak, they might completely ignore you and ask you, why are you here? They are not aware of the deficit.
Yeah. At that time, if you ask me when it was happening, I did not lose consciousness. I did not fall. If you ask me right at that time, I would tell you maybe I'm a little lightheaded. That's the only thing I felt. We were all still wearing masks. It happened in 2021, so we're still wearing masks, and it was on a warm day. So I thought maybe it could be dehydration, or it could be just, because we're wearing masks, maybe shortness of breath. But so the point I wanted to bring up is that I did not know I was having a stroke. I wasn't expecting one. So it is so important, like we talked about the BFAST, which is the acronyms for stroke symptoms. It's so important that I had angels around me who know I was experiencing these symptoms and take me to the hospital. So that's why I'm speaking up about.
Well, you were very lucky on both ends. You have people with you and you have a neurologist friend.
It's divine timing, I tell you. I mean, I'm very, very blessed. This is definitely divine timing.
That. I really like that. Yeah.
I'm so grateful. So that's why I feel like I can do my part because the more people are aware of these symptoms, or better yet, if the people who know these symptoms start teaching their family and friends, everybody have these awareness, and we can send the stroke patients to the hospital as soon as possible. And because the symptoms were so non-specific, if you asked me at the time, I would say, oh, I'm a little lightheaded. Like the worst thing that anyone could do for me would be, oh, go take a nap and sleep on it, because then I missed the 3-hour golden window to get treatment.
No, right? Thankfully you were very lucky. There's no.
I was at the hospital within, I want to say, an hour, if not an hour.
I want to build on that by saying that whenever you're experiencing these symptoms, the timing of you getting to a hospital that can handle these things is crucial, extremely important. In fact, the limit is 3 hours, and because what they can do when you're having these symptoms, to give you an injection of what is called TPA, which is tissue plasminogen activator, which actually melts or dissolves the clot, as simple as that. So, but if you go there in more than 3 hours, they may not be able to dissolve that clot. And once they dissolve that clot, then the blood vessel opens again, and the blood starts streaming through the blood vessel, and the brain is revived, essentially. So 3 hour is really a crucial time to get to a hospital. Now, here's one problem with this. There are areas of the country where you can't get to a hospital to do these things within 3 hours, even though you can actually have the transportation. You should be able to get to a hospital, but they might not have this treatment available at that time.
You brought up a good point. The nurses or the doctors at the hospital said their hospitals that are stroke centers. So if you call 911, the ambulance will know where to take you if you are having a stroke or you're having a heart attack. They take different hospitals. And my friends, my doctor friends, you probably know that they said if a stroke patient is coming in, I think their computer screens will have a certain code and saying stroke patient coming in like 5 minutes, 2 minutes. And I heard that they have everything ready in the ER. You bypass triage, you go straight to the room with the scans, because time is money here, or time is, it's a good point. It's called time is brain. Time is brain. Okay.
That's the name for it. Time is brain. The more time you have, the less brain you keep.
Right now, ER, if you go through triage, you may be sitting there for hours and miss this golden window. So I learned that you need to call the ambulance and get to the right hospital is key.
Absolutely.
That as well.
Yeah.
So Joe, you mentioned that, like for my case, I actually had something called a PFO, which is a hole in my heart. So everyone was born with it. It's supposed to close at a young age, and mine kept open, but I did not know that it was left open, but it's a small hole. And that was when the clot travels through that hole to the wrong chamber of the heart, and the clot went up to the brain instead of the lung. So my treatment, like you said, was the TPA, got rid of the clot at the time. So I wanted to ask you, like, what are the other treatments? You know, like your technology actually has some ways to help stroke patient as well, right?
So thank you for mentioning the PFO, which stands for patent foramen ovale. Foramen ovale is a communication between the top chambers of the heart. There's left heart and right heart. They both work together, obviously. But the left heart, at the top chamber, the atrium of the heart, as you're a fetus, you know, you're not breathing. So the difference in blood between the left and right is not the same. And so the blood, this foramen ovale opens, and the blood can easily go between the left and right side of the heart. So it has a useful function, obviously. And I also wanted to add here the fact that what made a difference, and what might make a difference for people listening to this conversation, is that whenever I knew that you were having a stroke, and correct me if I'm wrong, you went in on a Thursday or a Friday?
It was a Friday.
It was a Friday. You went in on
it was maybe a Saturday, a weekend, yeah. So
you went in on a weekend, and because of your age, we were on the phone. You and I talked on the phone during that. Because of your age, there's two places where you can have a stroke from to the brain, a blood clot to the brain. One of them is from the heart. The other one is from the carotid artery, which is the artery in the neck that goes to the brain, right? And in your case, you were too young. You were healthy. You exercise. You eat well. I said that cannot possibly be. It could, but it's unlikely that it could be from a carotid plaque, which is, you know, a deposition of tissue in an artery from where a blood clot can go. So I said, Grace, make sure you mention to the doctor that treating you that you want to be checked for a PFO. And in fact, if I remember correctly, I sent you a document from the Cleveland Clinic that described what PFO is. And your doctor was smart enough to know that and to look for that, essentially. And here's what I wanted to say. You went in on a weekend, and usually in some hospitals on a weekend, you don't get seen by the doctor, by the attending themselves. And I said, you know, make sure they don't discharge you over the weekend, because you have been seen by the emergency room, and the specialist doctor cardiologist who specializes in this PFO may not come to see you. So insist on not leaving on a Sunday, insist on staying on a Monday, because then the cardiologist will see you and make the right diagnosis. And I think that's what happened. And so if you're young and you're having a stroke and you're healthy otherwise, don't leave the hospital on a weekend. Stay until the weekday, until you get seen by the specialist doctor.
Yeah, they kept me at the hospital for 4 days, and it was at the Good Samaritan Hospital here in Los Gatos. So it's a great hospital, and the nurses and doctors were great. And you're right, like most of the time I was just waiting for the doctor to come by and talk to me, and that was on a weekend for sure. Yeah.
Right.
So Joe, yeah, go back to what we were talking about. Like you said, you know, once the TPA get rid of the blood clot, there is some time for the blood vessel to recover immediately, right? And so tell us a little bit about that. And then what happens after like 6 weeks of that recovery? Your technology can help the patients with that?
So the time life, the chronology, or the time history of strokes, the brain can sustain loss of blood for a few hours. You know, it's like if you're drowned, how long can you be out and you can still come back after that? So in this case with TPA, we know that that time limit is roughly about 3 hours. So long story short, that means that if you have a closed blood vessel because of this clot, the brain tissue that is suffering from that does not die before 3 hours. So it's still saying, where is the blood? I need more blood. Send me more stuff here. It comes from, by the way, it does start coming from neighboring areas who resuscitate this. So at some point, it cannot survive any longer. And that's when it gets damaged. And that's when you have permanent symptoms from the stroke. Now, coming back to your question, whenever we first see a stroke in a hospital, so let's say that you had a weakness on a scale of 1 to 10. Let's say on a scale of 1 to 10, the weakness is 5. We never tell the family or the victim of the stroke or the patient, we never tell them this is what they're going to be like for the next several weeks or months or stuff like that. So we tell them that the brain, even when the brain is damaged, it will very, very quickly start to look for blood vessels around the area that's damaged to regenerate some blood vessels and to borrow blood from these areas. So usually that takes about 2 or 3 weeks to regenerate some blood vessels and to go to the right place. So I never, when I look at a stroke, I keep on saying to the family or to the patient that don't count on it staying that bad or don't that weak or losing speech for that long. Within 2 to 3 weeks, his time, usually function comes back partially. What used to be 5 out of 10 weakness may become 2 or 3 out of 10 weakness. So don't make a judgment immediately. Now, after 2 or 3 weeks of time passes, then you're gonna be left with what you're gonna be left with, maybe small improvement over time. But let's say after a month or 6 weeks, you're probably gonna be left with what you're gonna be left with for a long time to come, essentially. And this is what you mentioned about the machine that we work with. It's called magnetic stimulation of the brain, or transcranial, means through the skull, transcranial magnetic stimulation. And this is a rather new technology that actually deals with recovery and rehabilitation in a much different way than with new blood formation of new blood vessels. And here's how it works. You can improve function in the brain, and until we developed this technology, until that technology was developed, we did not know that. But there's 2 things that can aid recovery. One is supplying new blood vessels that send blood and oxygen to the damaged area of the brain, or by creating new synapses. That means the connection between brain cells, between each other, essentially, by creating new synapses that then go to the area of the brain that's damaged and recover function. And here's where I'm going with this. So basically, if you stimulate the brain with magnetic stimulation using a coil, right? So it's a completely outpatient procedure. You put a coil over the head and you stimulate the brain with magnetic impulses, not with electricity, with magnetic impulses. That's why you don't feel it very much. So basically the brain, something that happens in the brain is called neuromodulation. Modulation means changing of structure. So new synapses begin to develop, and then they go to that area of the brain that was damaged and regenerate some of these synapses. And the reason we know that this works is because we've had patients who 6 months after the stroke and were not improving anymore, you start giving them TMS, transcranial magnetic stimulation. And there's, they might be like this, let's say, and then you start giving them TMS. Over time, they might become like this. Now, the difference between this and this, I'm not going to tell you what the difference is, but you can imagine if you're here, you can't feed yourself. But if you get here, you can feed yourself. That's a huge difference in terms of recovery, you know? So, so this is a new technology that's not FDA approved, by the way, in the States, but it's approved in other countries like in China where they do it. In fact, in China, patients or families take the machine to their home, and it's supposed to be operated by a doctor. But I heard that in China, some family buy the machine and take it home. We cannot do it in the US. I want to be very clear. And they are taught how to do it, and they experience some recovery. So there's a future in this area, is all I'm trying to say.
Yeah. Wow. So your technology is helping the major depressive disorder. People who are massively depressed, and also in the future, you know, in the stroke recovery as well.
Exactly.
Yeah, that's
a great point. Yeah.
That's wonderful. So Joe, one last question for you is, what is our best defense against stroke?
Well, that's a great question. And so what causes strokes? We know a few things that do what we call risk factors. And these are high blood pressure, diabetes, smoking, which causes plaque, which deposits fat in the arteries. And these fat in the arteries break, and they shoot a blood clot inside the brain, and that's where you get a stroke. So risk factors like high blood pressure, diabetes, smoking, and that kind of stuff can cause stroke. In older people, I'm repeating myself, stroke is more likely coming from the neck. In younger people, stroke is most likely coming from the heart, like in your case. In older individuals, another cause of stroke is what we call AFib, which stands for atrial fibrillation, which is an unusual contraction of the top part of the heart. And so that causes the blood to stagnate, and then you have a blood clot that shoots. So these things, the risk factor can cause strokes. And in terms of the stroke due to blood clots, for hemorrhagic strokes due to aneurysm, I can have an aneurysm in my head now, for which I have no symptoms, and therefore I will never look for it. Same thing with you, same thing with anybody. In fact, the reason I'm saying that is because when you do autopsies on patients that died from several other reasons, from some reasons, we incidentally, I don't know the approximate percentage, but we find aneurysms in the brain for which that patient never had any symptoms. So you may be walking on the streets and having it and not know it. Having said that, aneurysms have a family history. So if you have a family member that died from an aneurysm, you probably have one. Just look into it. Not everybody does, but you have a higher risk factor. So basically, aneurysms, hemorrhagic stroke due to aneurysm, you might not have it, you may not know it, but also you might die and never have any problems from that. But if you have an aneurysm, hereditary aneurysm, if you have a high blood pressure, and that's a great risk factor, high blood pressure, treated regardless whether you think you have an aneurysm. If you have high blood pressure, make sure you take medications for that, because it will save you from a lot of problems.
Yeah. Well, Joe, thank you so much today for speaking with me on this call, and your expertise and your knowledge is going to help a lot of people. It definitely benefited me when I was going through it, and I'm forever grateful for you as a friend and as my consultant. Thank you.
You're welcome, and mostly it's a pleasure for me, because I think you're doing a great job by speaking about your personal experience. There's no more powerful message that you can send than a message about your personal experience.
Yeah,
so thank you, Grace, for doing that. Thank you.
So I'm going to share Dr. Jabre's information and his website, you know, in the video. So if you have any questions, or you can look up his company and his technology. Thank you again.
Great. You're welcome, Grace. Thanks. Bye-bye.